So Dr. Roan, when was the last time you actually started an IV?
It's probably been about a year.
A little bit further. You did great. First time in a year. Didn't even hurt. Yeah, you got a beautiful vein. This guy's got beautiful vasculature. He does CrossFit. How many days a week?
5 days.
All right.
Monday through Friday.
And we actually just started going to the same CrossFit gym, right?
Yep.
Tell us about your background and maybe what brought you to Vitality Lounge and what made you want to be a doctor in the beginning?
Yeah, I grew up in Texas, and it sounds cliche, but growing up I always said I wanted to be a doctor.
Yep.
Right? That's like my mom always said, you always want to be a doctor. And when I went to college, prior to it in high school, I got a job doing computer science, IT work for a company. And I actually loved it because, as I said about video games earlier, right? I love computers still to this day. So I started college as a computer science major. Then it was one of those where I realized, I love computers, but I didn't want to do it for a living. So I kind of, bounced around a little bit trying to figure out, I was engineering for a bit, and I was like, that's too much math. Then I was business, because I was like, I don't really know what I want to do. Then something clicked again. I was like, I would like to be a doctor. Whatever happened to that, sort of dream. So yeah, it took me 6 years in undergrad because I jumped around so much, but
Right.
Made that decision, ended up going to medical school in Fort Worth, Texas. Prior to that, I actually got a job as a scribe in the emergency room. So taking notes for the doctors as they go and see patients. And that kind of got me initially interested in emergency medicine. So when I went to residency, I came up to Cleveland to University Hospitals, did a 4-year emergency medicine residency. And then kind of what, changed was, a handful of years ago, I just started thinking, about my personal overall health and wellness, right? Taking care of myself, because working in the emergency room, I know you know that, it's sometimes it's difficult, right? Working 12-hour shifts in the morning and then flip into a 12-hour shift in the evening, and difficult to get to the gym, difficult to eat right, things like that. So that's really kind of where it started. Then, I talked to a doctor friend of mine who was like, hey, what about starting your own wellness center? So that's where this all kind of began. And, the rest is history there.
Yep. Yeah, I think we've been working together been working with Dr. Roan for about a year now. I think I started last August. We had this talk where we were going to open up this place and do some construction, and it all came together, it took a year of really hard work, and we've been working together. I think we work great together. And like he said, he is very technical savvy. Anytime I have a tech question, I definitely go to Dr. Roan for this. So because we've talked a lot about Vitality Lounge over the year of what we wanted to build this place as, what do you think what makes the biggest difference from Vitality Lounge from like other wellness centers and med spas?
I would say the biggest thing is, we have physician on site here. I'm here, right? I see all the patients that come through the door. I think a lot of the other med spas and things like that, at least in the area, they might have an NP or PA, but even a lot of times they're off site, right? They're, maybe even in another state. So I think that's kind of the biggest thing, right? So you come in for an IV, I'm going to talk to you, right? You come in for weight loss treatment or hormone replacement treatment, I'm going to talk to you. I'm going to review the labs with you.
Yep, exactly. And that's what I love about having you as a partner. He always picks up the phone, by the way, whenever I call him. He responds to text messages very quickly. He's very good with the patients. I love that about him because he does go over everything in depth with the patients, in-depth patient history, in person. We can do virtual if that's preferred, but he definitely does a fantastic job with the overall patient experience. It's just awesome to watch him work, and I've learned a lot from him. So why do you think in this, maybe in Cleveland in general, but I think overall there's like a growing interest in like personalized and integrative wellness? Why do you think that is, and why do you think we're moving away from more of the hospital-based care to like the care that we give here at Vitality Lounge?
I think a lot of physicians, right, that go out into, working in the hospital systems and things like that, primary care providers, they learn something that they learn in residency, and then they just kind of continue on. And a lot of them don't kind of transition into whatever the newer treatments are, the new research, things that are coming out. And I think that there's just a lack of physicians that are willing to treat patients with some of these kind of newer ideas and treatments and things like that are coming out. I also think that, you know, the systems, they're bogged down, right? So a lot of times you go to your primary care physician, you know, you might not even go over the labs, right, with your physician. A lot of times, my personal experience that I had, you know, earlier this year, just getting some basic labs and things like that was, you know, I got a message after the fact. Labs look good, right? And nothing explained to me, you know, well, I saw some abnormalities, right? Even though I know that they were okay, but you know, I think in general, a patient that doesn't understand blood work and what the labs mean and things like that, you know, they're not getting that sort of care, right? And I just want to go back into just kind of talking about the emergency room. One of the things is, for me, I love talking to my patients. The patient care is what I most enjoy about being a physician. And in the ER, I didn't really have time, right, to sit down and talk to a patient. You know, there's 10, 15, 20 patients going at once, right, that you're having to care for, and some are very ill. So you don't have that time, you know. And here, I really like it, and because I can sit down with a patient for, you know, however long they want, 30 minutes, 45 minutes, an hour, right? We can do that here. And that's what I really like. And I think that's a big thing that people are enjoying from this type of space as well.
Yeah, I definitely agree. Like the amount of time that you spend with your patients on an individualized level is huge, and the access they have to me and you is also great. You know, they can call and text us. They can go through me. They can go through our EMR to get a hold of us at any time. And I think that individualized care is what we're missing a lot in, you know, overall healthcare. Is like we just kind of are shuffling patients in and out of the door in the emergency department. And I would say, and you could correct me if I'm wrong, probably 80% of what we treat in the ER could be fixed with diet, exercise, having proper lab work drawn, hormone replacement therapy, weight loss, stopping smoking, stopping drinking, all those things, and the majority of people would be in a lot better way.
Absolutely, yeah, and I that kind of goes back to where, you know, a lot of the patients you see in the ER, you know, a lot of them are there for like a fix, right? I'm obviously not saying all of them, right? But a lot of them just want to fix whatever the current issue is, but whatever caused that issue, they don't necessarily want to go fix, right? I think a lot of the patients that are coming into these, you know, types of settings truly care about their health. And they want to be better. They want to optimize their health. They want to live long and be healthy. So that's a big difference too.
For sure. And I completely agree that we offer things that are a little bit different. You know, we have the multidisciplinary approach with me and you. Also, I act as kind of a health coach underneath the physician, personal trainer as well. And then we have like data-driven stuff that we do, like the DEXA scan, the lab work, all those things, the VO2 max. And we offer things that hospitals might not, the hyperbaric oxygen chamber, sauna, the IV drip sessions. And it's truly concierge medicine in a spa-like atmosphere,
right? Exactly,
you know, and you can relax. And this is what it's supposed to be. You're not supposed to be in a high-stressed environment like the emergency department where your cortisol levels are going through the roof, and when you're talking to your doctor, you know, and then you forget things in your medical history, and patients aren't as honest in things because they don't know you, you know. And I feel like we can get at a very personal level here at Vitality Lounge.
For sure.
So speaking of what we're optimizing here, maybe we can talk a little bit about the IV drips that we got going on. So for me and Dr. Roan today, we put together B complex, B12, vitamin C, glutathione, and NAD. And maybe we could talk about each of those a little bit, what we're going on, why we have each of those in our bags and what we're doing. And this is 1,000 cc's of normal saline. This is the typical drip that we put it in. We don't typically use lactated ringers here. So based off your experience, like the B complex, what would you say the benefits of the B complex are?
B complex is essentially all the B vitamins except for the B12. But, you know, I mean, you would think of like, if you think of like a typical multivitamin pill you're going to take, right? It's going to include those B complexes. But the benefit of the IV is you don't have that, what's called the first pass effect, right? So you take a pill, you know, it goes through the stomach, digestive system. A lot of that gets broken down. You're not getting it, right? So obviously B vitamins are important in a lot of different cellular functions in our body. But, you know, I think a big thing when you're thinking of B vitamins, a lot of it, you know, you're kind of thinking of like energy, you know, fatigue, things like that. So boosting that energy.
Yep. On that same level, then, what are the benefits of the B12? Because we also have the B12 in here. That's why the bag is kind of red. Between the B complex, which is a yellow color, and the B12, which is red, what are some of the benefits of the B12?
I would say the B12 is kind of the more powerhouse of those B vitamins. So even more energy than what you would get from just the B complex alone.
And I can attest to that because I do an infusion about once or twice a month. And the B12 is what really keeps me going when I'm like really dragging throughout the day. If I do one of these, it definitely helps me throughout the day. And I think it is the B12 that's really working immedially, at least. I feel the immediate effects of the B12.
Well, one thing I want to say too is, since I started having the vitamin, IVs, when you typically take a multivitamin, right? You you taste it, right?
Yep.
When you get the IV, you can actually taste those B vitamins.
Yeah.
And another thing, this is more anecdotal than anything, right? But when I do a IV with the B complex, the B12, another thing, I don't know if you've noticed, but after you might be taking multivitamins with the B vitamins, your urine smells like those vitamins, right? When I do the IVs, it's like for 2 or 3 days that I can smell it.
Yeah, definitely
so
lasts
it's
a lot
there,
longer.
it's hanging around,
yes,
right?
for sure. And it's not getting broken down in your system, like you said. It's going directly into your body, not going through the gastric contents in your stomach. So definitely more effective. The other one that we got in there is vitamin C. So what are we doing with the vitamin C, and why is that in the bag?
The vitamin C, really similar to the glutathione, that's also in there. Both antioxidants, right? Helping to keep the cells healthy, essentially. And the glutathione is kind of like that, again, powerhouse, It's kind of like the B12 is to the B complex as the glutathione is to the vitamin C, right? It's that kind of next step up to really help.
For sure. And I've even noticed like the anti-inflammatory effects of the glutathione. Like when I get an IV infusion and then the next day I look in the mirror in the morning, like when I'm in a fasted state, I can literally tell the difference, and my cognition seems better. And I think that's the glutathione working for me, at least from my experience of getting these IVs multiple times. I definitely like that combination of the vitamin C and glutathione. Now, the latest one that we've just brought to Vitality Lounge is the NAD. And we're kind of giving ourselves like a micro dose of the NAD because it's Dr. Roan's first time having the NAD. And you can have some flushness and a little bit of maybe abdominal discomfort when you get it the first time. So we want to start off slow with the NAD. But from your experience, what are the major benefits of NAD?
So NAD is already in our body, right? But as we age, those levels start declining. And what NAD really does is it really helps with mitochondrial function. So if you remember back from like grade school biology, mitochondria is the powerhouse of the cell, right? So it really helps with that function, right? Keeping the cells functioning like they should, right? And then it helps, just keep the cells healthier in general, right? Not degrading from, age-related issues and things like that.
Yeah, definitely. I mean, and I felt the difference. I felt my cognition, like I said, along with the glutathione, when I added the NAD, I felt like my cognition was almost a little better because it does have direct effects on the brain.
Yeah,
from
absolutely.
what I've read. So great combination in this bag. We offer it to all of our clients. When you come in, you will see Dr. Roan, and then we decide on what was going to be best for you. This is my favorite combination, at least, and I already kind of feel the warm effect from the B12. I don't know how you're feeling right now. How do you feel?
I feel good right now.
Yeah.
I taste the vitamins,
for
definitely.
Sure. Yeah.
But so far, so good. Yeah.
All right, great.
Might have to call this one the Rick.
That's it. Yeah, that's my combination right there. So we're going to kind of pivot to some of the other things we do here at Vitality Lounge. So we do weight loss, correct? So a lot of the medications that are out there are GLP-1s, and we mostly focus on semaglutide and tirzepatide here. So there's a huge buzz around these two. Can you tell me how they actually really work and what the difference maybe is between the semaglutide and the tirzepatide?
So they're both GLP-1s. The tirzepatide is a dual action, okay? So it's actually exerting two effects on the body. And really the main difference in them is the research has shown that with tirzepatide over the semaglutide, that the weight loss improvement is a bit better, as well as patients have less side effects typically with it. Now, I will say, everybody's different, right? I've had patients that were on semaglutide and had no side effects, and then eventually decided they wanted to try the tirzepatide and then had side effects, right? So it's not, one size fits all. But, really the kind of two big ways that they work, right? The first is they slow the gastric emptying time, right? So your stomach, when you eat, you hold on to the food longer. Okay, so you fill up faster, you stop eating, you know.
Yep.
So in general, you're going to eat less, right? So less calories in, you know, should lead to weight loss. Another thing, kind of the way it works, and they're still, you know, studying this a bit, is really kind of drowning out that food noise or those cravings. So, you know, I have patients that tell me, you know, they get on it specifically for weight loss, and they're like, you know, I stopped smoking cigarettes, you know, or, you know, I used to drink a 6-pack every Friday and Saturday night, and now I'm not drinking anything, or maybe I'm only having one beer, you know, because it just, their craving for it is gone.
Right. So I know that you have tried the semaglutide, correct? And you had some good results with it. What was your experience with the semaglutide? I've tried it as well.
Yeah, so for me, I started it because, you know, I was about 210 pounds and knew I needed to lose weight, right? My goal was, you know, maybe 170 to 180. And, you know, I wasn't, my diet was good, but I really wasn't focusing on my workout as much as I should have been. So I joined CrossFit. So I started doing CrossFit. And after 6 months, my weight didn't change, right? I was still 210. You know, I'm sure I gained some muscle mass, lost some fat, but like, I really needed to lose some more weight. I met criteria for it, so it's like, all right, you know, sure, I'll give it a try. I've treated dozens of patients with it at that point. And so I gave it a try. Over 6 months, I lost 30 pounds.
Yeah.
Kind of plateaued after that, but I was at 180, which was about my goal anyways. So, you know, part of the reason I did it, right, was obviously for health reasons and to lose weight, but because I am treating patients and I met the criteria to take it, I figured why not take it so I can explain to patients, my patients, right, you know, how I felt. So I was able to lose that 30 pounds. Kind of the main thing, I wouldn't say that I had, you know, nausea really, which is the most common side effect people may experience. But I just, what I tell people is like, I kind of felt icky sometimes, especially, you know, the way you dose it, right, is you start off with a really low dose, okay, and you do that once a week for 4 weeks. And that's really to get your body used to it, to try to avoid those side effects like the nausea or the icky feeling, right? And then you increase that dose, okay? And you can do that a couple more times if necessary to, you know, achieve your goals. And when I would increase the dose, I would notice a bit more of that feeling, right? Certainly, occasionally I would have a little bit of fatigue, which I felt like might have been from, you know, just really taking in less calories than I had been, you know, but as my body got used to it, then everything was okay.
Yeah, I agree with you on that. And we kind of used it for me for a little bit of different reason. You know, I didn't have much weight to lose, but like you had said, like it has effects on other parts of the brain. And I wanted to try all that. Like, okay, is it going to reduce my cravings for other things? And it definitely helped.
Yeah.
And I agree with you. I kind of felt a little icky when I was on it, and I felt tired immediately.
Yeah.
Like for me, I was tired all the time on it, and that was just my personal experience, but other people say they don't feel that at all. You know, and everybody's symptoms are a little different. So like, speaking of that, like, who do you think are like the best candidates for this medication and why?
So, I mean, as far as the actual criteria goes, right, it's, you know, anybody with, you know, a BMI 30 or greater, you're automatically a candidate, right? BMI 27 to 30 with another risk factor like high cholesterol, elevated hemoglobin A1C, high blood pressure, something like that, then you're a candidate. But I think, I mean, it's the closest thing, right, that we have to that magic pill that, you know, I think I've ever seen, right? I was born in the 80s, grew up through the 90s and the early 2000s, where it's like all the diet pills and different diet fads were the big thing. And in the end, most of that stuff really didn't work, right? Or maybe it was a kind of a patch on something, you know, overall that needed to be fixed, and it wasn't just going to be fixed with a pill, right? One of the things I tell people with the semaglutide is, you know, if you, let me rewind a second. Pretty much everybody asks, okay, well, when I stop it, is the weight going to come back, right? Well, the answer is, if you go back to eating exactly the way you were before, yeah, it's going to come back, right? But when you're on it, you're decreasing your intake, right? You're changing your diet up, whether that's, you know, decreasing bad foods or just overall decreasing your calorie intake in the day. And then, you know, once you get to your goal weight, you have to maintain that, right? Even when you stop the medication, if you can maintain that diet that you were having, it won't come back, right?
Yeah, and I agree with you. I had to change the way I was eating, and I know you eat like small, frequent meals throughout the day, as opposed to me, I do intermittent fasting. So it's really individualized of how you want to handle your diet from, and everybody's got different food intolerances and things like that. So when you're on the semaglutide or tirzepatide, it's a really good time to figure out what's going to work for you and to get into the exercise routine.
Right.
I think a lot of people are eventually so overweight that they actually have trouble moving. So getting those initial pounds off
Yep.
is really, what do you think about that in terms of just like getting people that jump start on their exercise routine?
Yeah, I certainly have patients that tell me, I try to work out and it's just so painful. And they'll even say, I know I'm supposed to be sore, right? But like, this isn't like a normal amount of sore. And it's because, they are so overweight, right? It is painful. It's difficult. And I've seen a handful of patients that are able to, shed that first 30 or 40 pounds, right? I mean, if they have that, such a long way to go, then they can really pick up their exercise routine and, really accomplish their goals.
I agree. I mean, getting off that initial weight is just huge. And speaking of like clients, specifically here at Vitality Lounge, what have you seen here? Like what type of weight loss, or can you tell me about a client experience story without mentioning names of like somebody who's really lost some weight and gotten back on track,
I mean, I would honestly say in general, most people, lose. I mean, it's all relative, right? To where you start. Somebody who starts at 200 with a goal weight of, 160 is going to be different than somebody who starts at 350 with a goal weight of 200. But I've certainly seen people lose, 50, 60 plus pounds. Absolutely.
And if you could give me a percentage of weight lost when exercise is included, how big of an effect that has, a more drastic effect when you're doing both?
Yeah, I don't have specific numbers, but what I can absolutely say is, patients that do the GLP-1, semaglutide or tirzepatide, and increase their exercise, actually start an exercise routine, have significantly better improvements.
Yeah, I agree. And I have a client right now who is actually training. We have a gym here as well, a Vitality Lounge, and we do a little bit of exercise management here. And she's on the semaglutide as well as doing the training, and her results have been dramatic, and we can check that, like we said, with the blood work and the DEXA scan to see which way you're actually trending.
Right.
So before we get started on the semaglutide, what are some of the things we're looking for in the blood work, if any? I know we've talked about thyroid and things like that before. What are specific things that you might be looking at in the initial blood work?
Overall, when it comes to the GLP-1s, it's really just checking this kind of overall baseline health. Make sure there's not some sort of underlying issue, especially something that could potentially be causing weight gain, right? So you certainly want to check the thyroid, because if your thyroid isn't functioning, that can lead to weight gain, right? Sure. So maybe a GLP-1 isn't for you. Maybe you just need to correct that thyroid.
Sure. And I think that's a good transition to something else we do. We talk about thyroid, that's produces hormones. So next is the thing that I would like to talk about with you is like the hormone replacement therapy. It's often called HRT or TRT, and we also do that here at Vitality. So let's talk about hormones. What are some of the common signs that someone might have a hormone issue,
Yeah, so for men, you really look at decreased libido, fatigue, difficulty gaining lean muscle mass, brain fog, and then kind of going in just that that's really thinking of testosterone. Women can experience that same thing, right? When a lack of testosterone. But then with women, you kind of start thinking more of like estrogen, right? Women going into perimenopause or postmenopause can lack that estrogen, and that can cause things like hot flashes, night sweats. That can also cause the brain fog, right? So yeah.
Yeah, I have direct experience with this. I mean, I got my labs drawn here, and my testosterone was super low. It was 260, and my free testosterone was also low. And I did the semaglutide for a very short period of time, but really the game changer for me was the hormone replacement therapy. I was able to put on the lean muscle mass you're talking about. My cognition got better. My overall mood stabilized. And I'm actually off of antidepressants now from being on the hormone replacement therapy, and I contributed all to that. And it's many things, it's the optimization we talk about, optimizing not only your hormones, but your entire lifestyle. Each one of these things is just a little piece, right? So that's what I feel is the biggest thing the biggest thing that has effect on me was actually the hormone replacement therapy. So how do you actually, you kind of walked me through it when I first started my hormone replacement therapy. Can you talk me through the process of how men actually can get on the therapy, and what are the guidelines? What do we draw and why? Because we do labs here specifically for hormone replacement therapy.
Yeah, so looking at labs, right? Obviously the hormones, but we're looking at things like your CBC, your complete blood count. Making sure your red blood cells are an appropriate, safe starting area before we were to start something like testosterone, because testosterone could potentially cause fluctuations in that. So we're looking at that, right? We're looking for make sure there's no underlying liver disorder. Again, going back to the thyroid, right? If your thyroid isn't functioning appropriately, that can cause fatigue and weakness and things like that. So we check that. We check something called an SHBG, or sex hormone binding globulin, which can actually connect to or attach to our testosterone in the body and cause it to not be bioavailable for our bodies to use. So then, then we're checking total testosterone levels, free testosterone levels, and, making sure, right, that this appears to be the cause of the symptoms, right? Because if somebody comes in and, they say, oh, I have low libido, I have, difficulty gaining lean muscle mass, I'm fatigued, things like that, and you check their testosterone levels and everything looks good, it's like, well, this probably isn't what's causing it, right? So maybe we need to dig deeper and try to find the root cause of these symptoms.
Sure. Yeah, and specific for men, there's two different types of medications we use here. We use the actual testosterone cypionate, which is an injection, and then we also use enclomiphene or clomiphene. Can you speak to the rationale? Maybe we try people on the clomiphene and we see how their levels are. Can you explain the rationale, what clomiphene is versus actual TRT?
Yeah,
in
so
testosterone.
Right. So, it depends on the age of the patient, kind of where they're at in life and what their goals are for the future, right? I'd say a big point in difference between the enclomiphene and testosterone injection is that when you take testosterone injections, you're essentially shutting down your body's supply of it, right? So your body isn't making anymore because it sees all this testosterone floating around. So a side effect of that could be infertility, right? So if men are still interested in having children in the future, that's typically not something you would want to start on. Plenty of men we see, right, are like, no, I already have 2 or 3 or 4 kids, right? And we are not having any more, so that's not a problem. Now the enclomiphene, on the other hand, actually kind of maintains your body's own testosterone production. So it tells your brain, produce more luteinizing hormone, which then in turn tells your body to produce more testosterone. So increases testosterone, but it's your body's own supply of testosterone.
Yeah. And I think that's where we typically start people, depending, like you said, age and other variables. And clomiphene seems to be a good starting point, and then if that absolutely does not work for you, then we can switch you over to the injectable testosterone.
Right, exactly. And obviously, and the enclomiphene's a pill as well, right? So some people just don't want to do injections; they want to take a pill.
Exactly. Now, can we talk about so we talked about men? Like, how does the same type of thing happen with women in perimenopause, postmenopause, and what are some of the things we can do for women that are experiencing some of the same symptoms?
I mean, essentially, it's kind of the same plan, right? Where it's checking all the hormones, obviously checking to make sure there's not something else causing these symptoms. But if the patient is having symptoms, right, again, of decreased libido, increased fatigue, decreased muscle mass, vaginal dryness, night sweats, irritability, mood problems, things like that, brain fog. If they have those symptoms and then we check their hormones and you look at their testosterone level, their estrogen level, their progesterone level, right? And you see those abnormalities that are consistent with that perimenopause or postmenopause, then they're certainly, candidates for that.
Yeah. So we check specific labs for men and women here. So specifically speaking about the women, what are some of the medications we can put them on? I know we talked about the enclomiphene and the injectable testosterone for the men. What do women typically take?
Typically we'll do a cream, okay? Because, women can do injectables, but the thing is, it's when you do an injectable, right, you get a spike. So, you do the injection and your testosterone shoots up. And then it starts slowly, decreasing, right?
Sure.
When you do the cream, it's kind of, it's a more steady state, right? So that's what I feel like patients seem to have the best outcomes with. So, we can do creams, we can do testosterone and estrogen, together or separate, and as well as, progesterone, like pills.
Yeah, I agree. And I think that For me, the hormone replacement therapy was a lot of the brain cognition, and I think that people with the mood swings, irritability, it could be just a hormonal imbalance, and we can adjust those things with the hormone replacement therapy, which is amazing. So we talked about the fatigue, brain fog, mood swings, libido changes, and then so typically once you're started on the hormone replacement therapy, we have to recheck your labs, obviously, and a lot of times me and you talk, we're not trying to necessarily bring your level up to a certain level. We're trying to see how you feel as like an individual, and what's proper for you. So we might increase a dose or decrease a dose based off of how you're feeling.
Right.
Can you speak to that a little bit?
Yeah. So, I would say, you see a patient come in, we'll say a man, right? Low testosterone symptoms, they have low testosterone, say their total testosterone is 200, okay? We start them on testosterone. Well, say he gets to 600, right? Some men feel great. They'll feel great at that 600, right? And that might be enough for them. Other men, maybe that's not, the appropriate dose for them to where they're still not getting those effects. And, so we adjust their dose, right? And then we get them up to say like 900 to 1,000, and then they feel great, right? But again, it's one of those where everybody's different, right? So, you might need a testosterone level of 600 to feel great. I might need a level of 1,000 to really feel that. And so that's why, we recheck the labs, right? See where they're at. Obviously talk with the patient, see how they're feeling. Because again, you're not going to just treat the number, you have to treat the patient as well.
Yeah, and I feel like sometimes with like the primary care, they're just looking at the number, and the number for testosterone for men and for women is a very large gap. It could be from 250 to 1,500 necessarily. So if you're at the lower end, that's to some doctor standards, that's within normal range.
Yeah.
And what we want to do is we're in the optimization game here, where we want to make you feel as best as you can on your wellness journey. So I think we look at labs a little differently than most primary care physicians.
Yeah, for sure. And you kind of just going back to even talking about kind of the GLP-1, just overall health in general, right? One of the numbers I like to point to is like the hemoglobin A1C, right? Which tells us kind of on average what our blood glucose or sugars have been doing over the last 3 months. Well, 5.7, okay, to 6.4 is pre-diabetes, okay? That means 5.6 is the high end of normal, but it's still normal, right?
Right.
According to the labs. So you might go to a primary care doctor and they see 5.6 and it's normal, don't worry about it, right? But you're 0.1 away from being pre-diabetic.
Right.
So that's not okay, right? It's time to start adjusting that, right? And getting it back down, out of that kind of, not danger range, but range where you might have issues in the future if you don't fix it now.
Yeah, definitely. I mean, I know that before I started my weight loss journey, I was pre-diabetic. I'm not pre-diabetic, but I was that 0.1 away from being pre-diabetic.
Yeah.
And now that I've changed everything, my labs have also completely changed. So that's like the benchmark. Our DEXA scans and our lab results, when they come in, when you get them drawn, serial lab results, that's what we're tracking, because that's actually manageable, tangible data that we're looking at every day to making sure that you're going in the right direction and not falling off. So huge benefits just by getting your blood work drawn frequently.
And you brought up a great point, because that's something I always tell the patients, right? Is when you first sit down, first visit, look at that first set of labs. This is your baseline, right? We're gonna fix this now. So if we do it again in 3 months or 6 months or whatever it might be, I expect to see some improvement in this. Don't be worried about these issues that we see right now, even if you're in that pre-diabetes range, right? We're going to work on this.
Right, yeah. And I think what a lot of people are seeing in the health and wellness industry is just like an investment in your health, because like this is not a Band-Aid like we talked about before. Like you come into the ER, you just want fixed right now, and then you go home, and then you're still diabetic when you leave the ER.
Right.
You still have congestive heart failure. You still have all these things going on, and you're not doing anything to fix them. Here we kind of focus on, like we said, the optimization and like really investing in your future. And I know that we've both been on a wellness journey, you doing the CrossFit, me picking up CrossFit, doing weight training, running, things like that. So we're testaments to, you can change in a very short amount of time. What was it, a year?
Yeah,
You know, that
absolutely.
we've changed, and we're a testament to see what we actually do here at Vitality Lounge.
Yeah.
'Cause we are the face of the company, so I think that's great that we're actually both working on the optimization game. So now let's talk about a little bit about IV. So we talked about the weight loss medications, the GLP-1, semaglutide, tirzepatide, the hormone replacement therapy for both men and women. So why do you think that IV infusions are so popular right now? What do you think brought this about?
I mean, I think obviously it's just that really increased interest in overall wellness as is anyways, right? And I think, a lot of patients kind of, as we talked earlier about, you take a vitamin pill, there's nothing wrong with that, right? I mean, I take vitamins every day myself, but when you get the infusion, you're really getting the infusion, right? You're getting those vitamins, again, directly into the bloodstream, right? They don't have to go through your stomach or your liver or anything like that right off the bat before they, are able to exert their effects on the body.
Yeah, I agree. I mean, I think it's direct delivery, and for people who like, one person, people that I talk about is like businessmen. A couple businessmen come in here on a week, bi-weekly basis or monthly basis, and they can actually come here, get some work done, get some increased energy levels, and continue on their day. A lot of people think that this is going to take a lot of time out of my day to do this, when really, for the majority, if we put a sizable gauge needle in you, you can have this done in 40 minutes.
Yeah.
And a lot of people have been coming on their lunch breaks, and it really optimizes their game for the rest of the day, which is what I like about the IV infusions. It's like, okay, I'm kind of feeling that noon crash, after lunch or whatever. Let's go get an IV infusion and feel a little better to push through, because there are a lot of business people in this area who are really trying to make their way in their career.
Right.
And I think that this is a great way to kind of boost you throughout the day, and also have those effects that you talked about earlier for a couple days.
Yeah.
So what would you say the most common nutrients we're giving here at Vitality? What would you say majority of people are seeking out?
I think from my experience, a lot of the B vitamins people like, right? We obviously are just firing up giving NAD plus, right? I think that's going to be huge. That's the one I think I'm most excited about. Obviously giving it a try myself now, and it's something I've heard great experiences with.
Yeah.
I don't know, what do you see a lot?
Well, yeah, since I start every single IV here, I see a lot of, so we do the high dose vitamin C as well as like an antioxidant, releases oxidative stress in some cases. But yeah, the glutathione is people really taking an interest in that for the anti-inflammatory properties. We have one patient who can't take NSAIDs, non-steroidal anti-inflammatories. He comes in just for the glutathione for aches and pains and things like that. Now, we have a couple people that actually take it at home, like an at-home injectable. But yeah, I would say the glutathione, a lot of the vitamin C, as you said, the B vitamins for the energy and extra boost. We've taken care of some higher end clientele who fly in, and they have a show to do, or they're part of a band or something like that. And they've been traveling so much that they actually just need a little bit of a boost. Say they just got off of a 5-hour flight, they just did a set somewhere in another state, and they got to be ready for their set now. And that's who we've been kind of seeing. Some people, I saw 2 people yesterday that were in a band. He just wasn't feeling right. Wanted to make sure his performance was on par, so gave him an IV yesterday.
Right, and on that same point, not even necessarily kind of the band or anything like that, but I've seen a lot of people in general that are just traveling for work, right? Where they're just drained from all of it, so they get back, get their week started again with an IV, right? Or I've also seen people, I'm going to New York City this weekend, for a friend's birthday, and I just want to get boosted up before I go.
Yeah, and it definitely does help. Now, speaking of getting boosted back up after something, we offer the hangover infusion as well. So we get a lot of people in here just for the hangover infusion. Can you tell me what's in that and why we give it?
Yeah, so that has our B vitamins in it. It has our Zofran in it, which is a nausea medication. And a big part of hangover is really the fluids themselves too. It's a lot of dehydration, and I've seen so many patients that come in and you can tell they're hungover just by looking at them. And then by the end of it, they're like, I've actually had one patient before, I recall, said, yeah, I'm already making plans to go out again tonight.
Right.
I was like, I don't know if that's a great idea, but
Can't advise that, but we'll definitely help you feel better, right?
Right.
So yeah, I have seen that's another big one is the hangover infusions. Get a lot of people early morning, like I need to get back on my game, and
Yep.
it definitely does help with the rehydration. So yeah, that's the IV infusions. Some of the other questions that I wanted to ask you. Let me find my page here. So. Sticking, I guess, with the IV infusions, what are some of the things people should know before getting an IV infusion? Is there anything that you really were checking for or you ask them about when you're doing your intake?
Specifically, we want to make sure, obviously, we take a full health history, checking for any medical problems, right? Any issues where maybe it would not be appropriate to give somebody an IV. So, patients with congestive heart failure should not be, just receiving IV therapies,
Right.
just because, right? Another thing is, patients who are pregnant, okay,
Yeah.
Aren't somebody that we would want to, treat with an IV just because we don't want to risk any potential issue, for the fetus.
Yeah.
Obviously we could do just, saline by itself, but when it comes to the vitamins and things like that, that's typically something we would avoid.
Yep. All right. And then just some things about you. Let's just go with a couple fun questions. What's your favorite place to eat in Cleveland? What do you enjoy?
Oh man, one thing I will say, coming here from Texas, the food scene in Cleveland is fantastic.
Okay.
Texas, it's all chains, right? Not a whole lot of mom and pop spots. I'd say it kind of depends on the occasion. Probably just in general, Astoria is probably one of my favorite go-tos.
All right.
If it's like a fancy, very rare, very fancy, if it's celebrating something nice, Marble Room.
Yeah,
Is
Marble Room is
fantastic.
awesome. Yeah, for sure. Their steaks there are amazing.
Yeah.
And then we talked about exercise. What is your favorite? I have my favorite exercises, my favorite motions that I do in the gym. What is your favorite exercise to do in the gym, would you say?
I mean, obviously just CrossFit in general.
Yeah.
I've been doing it. I think I just had my 2-year anniversary like 2 weeks ago or so.
Yeah.
I love it. I've seen such a drastic improvement myself, my body composition from it. But I would say if I have to pick one exercise, deadlifts.
Yeah.
Like to lift heavy things.
Yeah, I agree. And I believe that, truly when you're trying to lose weight and your metabolism, things like that, doing the heavy compounded movements, especially using your leg muscles, really spikes up your metabolism.
For sure.
So I have to agree. I do something for legs every single day to stay lean. So I do like the deadlifts and squats as well myself. And for you, what would you say your number one tip for somebody is trying to make a lifestyle change? What is if you're like completely lost and you're like, I don't know where to start, where did you start and what would you recommend to someone?
I mean, so, I think I might have mentioned it earlier, I started initially with, what I knew my issue was, holding myself accountable when it came to working out, right?
Yeah.
Like I said, I would go to the gym, I'd kind of mess around for a little bit, and I just knew, I was like, all right, what my problem is here is that I'm not being held accountable. So that's why I joined CrossFit, right? I go there, they tell me exactly what I'm doing that day, I do it, I go home. I would say the big thing though is, maybe identifying something like that, whether it's, an exercise routine, maybe it's avoiding, a certain food or drinks, not drinking Cokes, multiple times a day, things like that. But it's really, you have to build the routine, to build that habit, you have to do it for an extended period of time, right?
Right.
1 week isn't going to cut it, that's not going to break the habit. You really got to do it for multiple weeks, if not multiple months, and just stay on top of it, right?
Yeah, and I agree. I mean, one shot of semaglutide or one hormone replacement pill is not going to do it, right? You need to stay on these things for a long time and really invest in your health.
It's a journey.
Yeah, so now that we're, kind of gotten the IV infusion and you're feeling good, give me 30 seconds of why someone should come to Vitality Lounge. What do we offer here in 30 seconds? What is the best things that we offer and why?
I mean, I think everything we offer is fantastic, right? But, I think it's just for anybody, right, that is really interested in, their overall health, but like really optimizing your health, right? So, like I said, we talked about the lab work, right? We can do extensive lab panels, including all the hormones, things like that, give you a real idea of, where you're at. I think another big thing I love is our DEXA scanner. being able to see what your body, composition is, seeing what your fat percentage is versus your lean muscle percentage, and then knowing, right, kind of like I said earlier, this is your baseline. Okay, now focus on yourself, and then work on it, repeat the labs or the decks in the future, and you see that number improve, right?
Yeah.
Stepping onto a scale can only tell you so much. It just tells it's overall weight, right? So you might get to a point where you're stepping on the scale and it's not really changing, but then you come back and do a DEXA scan and you're able to see, okay, well, my body fat percentage actually dropped by 4%, even though my weight didn't change, which means you gained some muscle mass in that time.
Sure. Yeah, I think that's great advice, measurable, trackable data, and that's what we like to focus on here. So as we come to a close, how do you feel with the IV infusion so far? How do you feel?
I feel good.
Yeah.
Yeah, I feel good.
What is something you notice besides the taste? Anything immediately?
Nothing immediately right now.
Immediate,
I think we got it going on a pretty slow rate, so
Yeah.
I'm not feeling any of that flushing or
Yep.
anything like that.
Yeah.
So
Yeah, I think you did great with the NAD. The first time I did it, I had a little bit of flushing, a little bit of a headache,
Yeah.
and now that I'm a little bit more used to it. So yeah, I think this has been a great session.
Yeah.
I really enjoyed talking with you, Dr. Roan, and I love working with you. So
I love
thanks for
working with
coming
you
on.
too.
All right, brother.